Welcome to the poster for Group 2, featuring the research talents of Lacey Daskalova, Catherine Cheng, Kayling Moriarty, Andrea Schreiber, David Ward, and Maggie Ewan. Since all 6 of us have cats and/or dogs at home helping us cope with the perils of accelerated virtual nursing school, the PICO question we developed and researched for Nursing 420 is, does animal-assisted therapy decrease anxiety in hospitalized pediatric patients more than play therapy?
Hi, this is Andrea presenting on the background and problem. There is a high incidence of pediatric injury and illness, resulting in approximately 5.3 million pediatric patients hospitalized in the U.S. each year. The hospital can be a frightening place for children, and these patients can develop anxiety as a result of being in an unfamiliar environment, a fear of healthcare providers, and a fear of pain. When a pediatric patient becomes anxious, administering treatment can become especially difficult. Furthermore, if left untreated, anxiety can result in serious long-term effects on a child's health and well-being, growth, and development. There is also evidence that suggests anxiety can impede a child's ability to cope with hospitalization and medical procedures, leading to a lasting impact on the child's future healthcare interactions. However, the addition of complementary health approaches, such as play and animal-assisted therapy, have been shown to decrease stress, anxiety, and pain in pediatric patients.
Hi, I'm Catherine, and I'm going to be talking about the purpose of our project. We wanted to explore whether animal-assisted therapy decreases anxiety in hospitalized pediatric patients more than play therapy. Breaking down the PICO question into its components, the population for the 6 studies we looked at included pediatric patients from age 3 to age 18. The intervention we primarily looked at was animal-assisted therapy, which is also sometimes called animal-assisted activities or pet therapy. The patients interact with therapy animals that are usually formally trained to provide emotional support or engage in educational and recreational activities. In this case, our comparison intervention was play therapy, which is also sometimes referred to as hospital play or toy play. The pediatric patients are allowed to engage in playtime, which helps with coping and stress reduction. Usually a variety of toys and activities suited for the hospitalized child's interests or how much activity they can tolerate are offered to them, with hospital staff and parents encouraged to interact with the child. Our goal was to look at how these 2 interventions impacted the target outcome, which was the pediatric patient's level of anxiety.
Hi, this is Maggie presenting our evidence collection method. We collected our data through the UNLV Libraries database, CINAHL database, and PubMed. We analyzed intervention cohort studies and quasi-experimental studies. Primary research articles were graded using the grading of recommendations, assessment, development, and evaluation known as the GRADE system of evidence rating. All of the articles that we utilized in our collection of evidence were peer-reviewed and published after 2015 to ensure that it had current and accurate data.
Hi everyone, this is Kaylin, and I will be summarizing the evidence we found. In regards to play therapy, evidence illustrated that play therapy was a more effective method for reducing anxiety compared to patients receiving only standard care. For example, in one study, the intervention group experienced a greater decline in anxiety levels per day with a p-value of less than 0.001. In a different study, the intervention group also experienced lower levels of anxiety through play therapy. You can see the p-values listed below. For animal-assisted therapy, evidence from 4 different studies gathered the following: an increase in well-being and hospital experience after AAT, statistically significant results in reducing fear, sadness, worry, tiredness, and pain, patient reports of increased happiness, feeling more relaxed, comforted, and being able to take their mind off their illnesses and pains. And lastly, in patients who were about to undergo MRIs, surveys indicated a 1.65 decrease on Likert scale post-intervention. This suggested that AAT may be beneficial in reducing anxiety in pediatric patients and therefore reducing the need to use sedatives prior to an MRI.
Continuing our summary of evidence, We were able to find one article detailing a study from 2019 that focused specifically on the question we pose in our PICO, relating the effects of pet therapy against play therapy in reducing anxiety levels in hospitalized pediatric patients. In the study by Hinnick et al., 93 hospitalized pediatric patients were split into two groups, one that interacted with a therapy dog and one that was assisted in completing an age-appropriate puzzle. Both groups received coping skills education during their interactions. Before and after each intervention, children self-rated their level of anxiety on a standardized scale. While the results of the study showed that both puzzle therapy and pet therapy significantly reduced anxiety levels, post-intervention anxiety levels were significantly lower in the children that received pet therapy. In fact, median anxiety level scores decreased 3 times as much for the children receiving pet therapy over their peers who received puzzle therapy. The findings also suggested that children respond positively to pet therapy whether or not they are accustomed to interacting with a dog or other pet at home. This study provided empirical data strongly suggesting that the answer to our PICO question is yes. As far as grading our evidence, we rated all 6 of the studies we focused on a B, or moderate, based on the grade system. Due to the lack of randomization in all 6 of the studies, further research is needed to conclude a causal relationship between the interventions and outcomes. Moreover, the groups in one or more of our studies were subject to bias based on healthcare provider selection.
This is Lacey speaking, and I would like to present the final slide of our presentation. In conclusion, the evidence of all of our studies show that play therapy and animal-assisted therapy are both substantial methods of treatment for anxiety in hospitalized pediatric patients. However, the study conducted by Hinnick et al. 2019 demonstrated a significant reduction of anxiety in pediatric patients receiving animal-assisted therapy compared to the play intervention, which was puzzle completion. A possible limitation to this conclusion would include the method of play used in the research. While puzzle completion was utilized, there is no set standard for play therapy, and certain children may experience therapeutic effects from different play activities.